Time now for a look at your health. Two new medical bills were signed into law in California, and they both involve children. So if you're a parent, listen up here. To explain how all of these new laws work is Dr. Bill Groff joining us. Thank you so much for being here.
Thank you.
Well, we heard a lot about this before it was signed into law. Let's talk about tanning bans or tanning bed bans for teenagers, because it really is the first of its kind in the country, is it not?
Yeah, California once again is setting the trend, and I think it's a great trend in this case because prior to this law being passed, children aged 14 to 17 could use a tanning bed with parental consent. Now the law has changed that anyone under the age of 18 cannot use a tanning bed unless they have a physician's recommendation or note.
And why would you even get that?
Well, there are some skin conditions, eczema, psoriasis, that will benefit from ultraviolet radiation, but you know, for most kids out there, ultraviolet radiation just causes skin cancer, and we're trying to bring skin cancer rates down, and they've been going up virtually every year.
Especially here in California, right?
Absolutely, and there is no doubt that indoor tanning beds do cause skin cancer, no doubt at all.
And we have some figures to show that in 2011, California is expected to have 8,250 new cases.
Well, that's the serious type of skin cancer, melanoma, which people do die from. There's probably one melanoma death an hour in the United States. So it's very serious and it's on the rise, and tanning beds are definitely contributing to this rise.
All right, so let's talk about the second law, because this is a very controversial one that's actually become somewhat of a political football, the HPV vaccine. Tell us what this new law means.
Well, for those that don't know, HPV stands for human papillomavirus, and that causes what's known as genital warts, but it also causes cervical cancer. So the new law, what it does, it allows girls age 12 and up to go into a doctor's office, and they can actually get the vaccine that protects them from getting cervical cancer and this virus without any parental consent at all.
And what's controversial about that is the fact that it's an STD. And so some people really feel that this is giving a green light to kids to go out and have unprotected sex.
Well, it's that, and it's also that many parents feel that they're being taken out of the picture. In other words, they're not having any say in their children's own health. And I can understand that, but on the flip side of it, there's a lot of kids out there that unfortunately don't have good parenting. Maybe they only have one parent involved in their lives that's too busy to pay attention. And for these kids, you know, if they're smart enough to realize, hey, maybe I should go get this vaccine, then they're probably responsible enough to maybe make that decision. But it is a very difficult and, like you said, a politically challenged law.
Okay, and we should point out that this bill was authored by Assemblywoman Toni Atkins from right here in San Diego. Well, Bill Groff, thank you very much.
Thank you so much.
For cluing us into what these laws actually mean. And we're going to send it over to Lauren. It's certainly the best thing you can do when it comes to anything controversial when it comes to your child's health is have a conversation with them as well as their doctors, Lauren.
Good advice, Kathleen. Thank you.